Hello and thanks for joining us on another episode of Health Options. I am Rabi Abdullah. It is no longer news that there is a new sheriff in town when it comes to leading the preparedness, detection and response to infectious disease outbreaks, as well as dealing with all public health emergencies in the country. The new Director General of the Nigeria Center for Disease Control, Dr. Ifedayo Adetifa, who was appointed on the 6th of September, assumed leadership of the center following the appointment of its first Director General, Dr. Chikwe Ihekwazu, as Assistant Director General for Health Emergency Intelligence at the World Health Organization. Our focus on this episode of Health Options is sustainable health security amidst COVID-19, cholera, Lassa fever, and other threats that we are going to touch on with the new NCDC Director General, Dr. Ifedayo Adetifa, as our guest. How prepared is he for these challenges? What is he bringing on board with his expertise? Join us for answers to these and more shortly.
Recently, both the President and Vice President demonstrated leadership by being among the first Nigerians to have the AstraZeneca vaccine administered to them on live TV for all in the country to see. Subsequently, many federal ministers, political leaders, and members of the Presidential COVID-19 Task Force have publicly taken the vaccine to follow in the footsteps of President Buhari and Vice President Oshibaja. To obtain it yourself, please go to the NPHCDA website. There is a link to click on in order to register and schedule your vaccination. In the meantime, please continue to wear face masks, wash your hands frequently, use hand sanitizer, and observe social distancing. This message was brought to you by the Federal Ministry of Information and Culture.
Welcome back. If you're just joining us, this is Health Options, and we're beaming our searchlight on sustainable health security in the country. To take us through the topic is the new Director General of the NCDC, Dr. Ifedayo Adetifa. He's an epidemiologist and consultant pediatrician, and until his appointment, an associate professor of infectious diseases epidemiology at the London School of Hygiene and Tropical Medicine, United Kingdom, among other positions elsewhere. We're glad to have you on Health Options, Dr. Adetifa.
Thank you very much. It's my pleasure to be here.
Yeah, congratulations on your appointment.
Thank you.
Okay, so we'll just quickly go to the nitty-gritty. Health security. Your wealth of expertise, your experience, I've done a whole lot of research on you, and maybe you should start by something that I did not mention. That's your link with the Kenyan research program. What is it all about? Because you seem to have made a remarkable impact there. Before we get down to what you've been called upon to serve, in your country now.
Okay, so for the last 7 years, I've been hosted by the Kemri Wellcome Trust Research Program in Kilifi, Kenya, where I have done, carried out most of my research on vaccine epidemiology, or basically on vaccine preventable diseases. And until more recently, I've also worked very closely with a team at the Institute and with partners in government to also respond to the COVID outbreak in Kenya by helping to generate relevant evidence to inform policy.
Okay.
Yes.
Okay, let's get down now to the discussion. Sustainable health security, for Nigeria. I'm saying sustainable because we could be said to have made a great progress with our health security. We just had your predecessor given a higher position at the World Health Organization. That says a lot.
Yes.
And you have stepped into his shoes now amidst COVID-19, cholera, Lassa fever, Hamilton is just setting in, and very soon we'll be talking about meningitis, the fact that Nigeria is on that belt. How are you going to take up all of this? What are you bringing on board?
Oh, the weight of expectations. Well, the the good thing about COVID, if there's any such thing in Nigeria specifically, is the amount of attention that it's brought, not just to Nigeria, to health security in Nigeria and in the continent. I think there's greater realization that we need to be invested in assuring our health security, and it has been reassuring to see the pouring of investment both in funds and in cash, in kind and in training and technical assistance by Nigerian government and other partners. And we believe that we need to continue to do that. And I have seen commitment from the government that that will continue. I mean, just yesterday we were at the National House of Assembly to defend our budget, and there was great acknowledgement from the House Committee about the importance of the NCDC and the work that we do. Now, health security is a constant issue. I mean, there are threats everywhere, both those that we know and those that we do not know. The emphasis has been on COVID because for once in a lifetime, we had a condition that affected the whole world. I mean, directly in terms of people having the disease, but indirectly because it shut down economies, it disrupted our ways of life. And as we now know, without wealth, there is no economy. I mean, without health, there is no wealth. And without wealth, your health is affected, which again drives the need to pay increasing attention to our health security. Well, the NCDC is primed. We are, as according to our mandate, primed to respond to every disease that might be of public health importance, but emerging, endemic and otherwise. We are, at the moment, continuing to consolidate our response to COVID as part of the concerted efforts by the Presidential Steering Committee. The strategy at the moment, of course, everybody talks about vaccination. That is one major pillar of the strategy for responding to COVID in the country. But we are still keen to keep testing, keep up genomic surveillance. We need to have an idea of what type of virus is circulating, and to be able to detect very quickly if we have any genetic modification that might increase the transmissibility or infectiousness of the virus, or indeed confound the virus, the ability to evade our immune system and then result in an uptick in our cases. So we are still following up very closely and implementing all of those. At the moment, I'd like to draw attention to cholera. As what people probably don't realize is there are 33 states in our country now that have cholera cases. At the moment, there are teams from the NCDC as rapid response teams in about 6 to 7 of those states. The last situation report is that we've had over 90,000 cases of suspected cases of cholera and about a little more than 3,800 deaths. So, as a matter of fact, we've had more deaths from cholera now than from COVID, at least direct deaths. Okay. We have engaged the Nigeria Governors Forum, who are working also hard with other partners to assure water and sanitation, which is really what you need to respond to the cholera outbreak and to prevent it from happening. But at the moment, we've got teams outside who are engaging with partners on ground to implement action plans to respond to the pandemic in terms of case finding, case management. We have teams helping with diagnostics, helping with standardized case management, and also helping with sort of water sterilization and information about how to source safe water for the period. And that is still ongoing. But as you've rightly identified, we are conscious that it's approaching Lassa fever season. As a matter of fact, we have had reports of Lassa fever from 2 states already. We are providing some support in terms of treatment and diagnostics as well. And we are preparing for meningitis. We've had substantial investments in the previous response to meningitis, and more importantly, in our overall ability to conduct surveillance. So the surveillance tools, platforms, labs, and other partners we need to make that work are still in progress, and we will be able to pick up both reports and detect confirmed cases when they occur. Okay,
let's look at health security funding for the country's architecture. Do you think it's something that is what it should be? Which of those areas do you think the country needs to step up its act? Because I know a whole lot of what you do revolves funding.
Yes, there is definitely areas to improve in terms of funding. But before we talk about that, I think it's important to highlight that in 2020 and even 2021, and for the budget proposed for 2022, we have received more funding from government than ever before, both for sort of capital and otherwise. And in fact, in 2020, records show me that we had 100% disbursement of appropriated budget for capital. So government is, in recognition of the increasing importance of health security, is providing more investment. But just like Oliver Twist, we need to ask for more investment if we are to ensure a presence in all over the country, including having regional laboratories so that we bring our response capability closer to the people and not everything having to come out from Abuja, to have expert staff to continue to maintain laboratories, expensive consumables, and all the related components of that, that system that we required to assure health security. We definitely need more investment.
Okay, in view of your expertise on vaccine-preventable diseases, I know that there's the good news out there about vaccine for malaria. Unfortunately, I learned Nigeria did not participate in the trials for that vaccine, and I'm just wondering, what's your take on such development?
Well, interestingly, I am on
I'm sure Kenya, was Kenya part of it?
Yes, and I am indeed on the Malaria Vaccine Implementation Program Advisory Group. So we worked behind the scenes supporting the implementation study to actually come up with the recommendations that ultimately went to the WHO's strategic group of experts and the recommendation that the vaccine can now be deployed. I think it's good news. It's overdue. This is a really a condition that really affects our under 5 children and pregnant women, and it was always important to get an additional tool in the armamentarium to combat malaria. So it's important to highlight that this is just an additional tool to add to case management, to insecticide-treated nets and prophylaxis and all of the other things that we have in place to make sure that we have an additive or combined benefit for
Dr. Adetifa, you are just coming in, so there's a whole lot of time to track your stewardship with time. But your final words to Nigerians, seeing you for the first time on our set.
Well, it is a privilege to have been appointed to lead the country's efforts to assure our health security. We will do our best, and I'm speaking for the whole NCDC team who you've previously engaged with and even the previous leadership. But we will continue on from the gains that have been made and the platform that exists to ramp up our efforts to assure Nigeria's health security to the next level. Speaking about COVID specifically, I'd like to appeal to fellow citizens to please take advantage of the offer of vaccines. I've been vaccinated. I've received 2 doses of the AstraZeneca vaccine. I feel a bit more comfortable, but please get your COVID vaccine so that we can move on away from COVID and deal with our other problems as well.
I've also taken mine. Thank you so much, Dr. Ifedayo, for making it to Health Options. We appreciate your time.
Thank you.
And good luck.
Yes.
All right.
My name is Dr. Faisal Shuaib. I am the Executive Director and Chief Executive Officer of the National Primary Healthcare Development Agency. Earlier today, I took my first shot of the AstraZeneca vaccine. Despite all of the delays, all of the doubts, here we are, Nigerians can finally access the vaccines. I hope that Nigerians will come out and get this vaccine because these vaccines are safe, they're effective, and they truly work. Over the course of the next few weeks, we have to continue wearing face masks. We have to do social distancing. But I know eventually once we're able to get herd immunity, then we'll be able to stop all of these non-pharmaceutical interventions. To get the vaccination, you should go to the NPHCDA website. There's a link on there that you click and you can register and schedule exactly where you want to get your vaccine.
Cholera outbreak in Nigeria is not new. In fact, in the last 5 years, we've had cholera outbreaks several times. And in 2018, we had over 40,000 cases in 20 states in 2018 alone, and very close to 1,000 deaths in 2018. Now, in the last 2 months, we've had cholera outbreak in about 22 to 23 states in Nigeria. Why do we have cholera outbreak? First and foremost, we need to look at, first and foremost, what is the access to safe water sources in Nigeria? About 30% of the population lack access to safe water. That's why. We also have 46 million people, which is about 23% of the population, practicing open defecation. What does that mean? They go outside in the open to pass excreta. And where does this excreta go? It still goes back to the environment. Now, cholera is just an offshoot of contamination of food we eat, now contaminated with fecal matter. It's as simple as that. So it's a fecal oral problem. When feces inadvertently is ingested into the body, it brings about cholera. It's as simple as that. So what do we need to do? Now, I know that a lot of people have been talking about cholera. It's a big issue in Nigeria. Yes, I agree. I totally agree. It's a big problem. And I'm also, interested to know that Nigeria happens to be the second most cholera endemic country in Africa after Democratic Republic of Congo. So it's not a new problem to us. Just like malaria. Yes, you are right. So it's not a new problem. So, and we also know what the causes are. The causes are people do not have access to safe water to drink. People do not have access to effective sanitation. People still practice open defecation. And let me also tell you, hand washing alone, it's a very important practice to prevent cholera. But in Nigeria, more than 100 million people, about 56% of the population, do not even have access to facilities for proper hand washing. So how do we expect to prevent cholera? That's the question. Now, it's not just about providing water. So you can have big water schemes. If you do not have effective sanitation facilities, it's still going to be a problem. Even if you have access to sanitation facilities, people do not have the behavior, they do not adopt the behavior of proper hand washing, washing your hand properly under running water with soap. And for people in rural communities, they can use ash. If you don't do all those things, you still have problem of cholera. We need to have community-led approaches to preventing cholera. First and foremost, even when we have water, safe water, it might be safe at the source. We need to look at the water chain. As we are fetching the water from the source, as we are transporting to the household, as we are storing for use in the household, we need to ensure that all the containers are clean. That's what they call safe water chain. That's very important. We also need to adopt the habit of hand washing at critical times. When we use the toilet, we come out of the toilet, we need to wash our hands properly. Nursing mothers who are taking care of children need to wash their hands properly all the time. Because as they touch food also, as they prepare food for babies, they prepare food for the family, we need to wash our hands. So proper hand washing is very important. And one of the things that UNICEF is also doing, UNICEF is supporting the federal government of Nigeria to develop what they call hand hygiene roadmap. And hand hygiene is all about proper hand washing. How do we keep our hands clean? As you see our fingers, when you look at them, they don't look dirty. But I can assure you, everything we touch has its own dirt. And these are small things that really lead to cholera. Now, if somebody is infected and the person defecates in the open and there is no rainfall, the rainwater will just flush everything straight into the water source. All the people who drink from that source will have cholera. It's as simple as that. So we need to ensure that our toilets are not close to the water source. And even if at all, the toilet has to be downhill while the water source is uphill. So it won't allow the sheet underground to climb into the water source. There are simple measures, but they are very important. While we also continue to encourage the government to ensure that Nigerians have increased access to safe water. I know there are quite a number of water schemes, and that's why UNICEF is also supporting government to not just to build new water schemes, to rehabilitate the existing water schemes. We need to rehabilitate them. We need to ensure that they are working. We also need to do campaigns, hygiene promotion campaigns. It's very important. As I said, the role of the media, the print media, electronic, and even the social media, very, very important. So we need to continue to do that. And I also think sincerely that chlorination is very important. The existing water sources will need to be chlorinated. UNICEF is also supporting in some of the states to do that. And we've just secured some funding from UK Aid, and I see that as the Swedish International Development Agency, to support some of these, about six of the states that are badly affected, to ensure that they have ORS, that's oral radiation salts, and then zinc tablet for people who are affected, and to also ensure that there's chlorination of the existing water sources and do hygiene promotion campaigns. We are really working on that. We are working with the federal government and also the states concerned as UNICEF.
My name is Alhaji Lai Mohammed, the Minister of Information and Culture. I just received my first dose of the COVID-19 vaccine, and I'm glad I did so. This vaccine has been proven to be safe and efficacious. And as long as we take this vaccine and we continue to obey the COVID-19 protocols, such as frequent washing of hands, use of sanitizer, wearing of masks in public places, keeping social distancing, avoiding gatherings, we are sure going to beat COVID-19.
That does it on this episode of Health Options. A quick reminder that you can watch these and other episodes of the program on our YouTube channel. Email us for your comments and contributions at healthoptions@nta.gov.ng. Stay safe and good. I remain yours, Rabi Abdullah. Hope to see you again.